Hi everyone. We're just gonna wait a couple more minutes just to make sure that everyone gets on here to start from the beginning with everyone. So we'll just wait a bit. I'm hoping everyone had a good weekend.
Yes. Did you?
I did, yeah.
What did you do?
I went out with my friends. We just spent time together, and that was pretty much it.
out and about.
Yeah, we went to this event that they hosted for POC people.
What is POC?
Like people of color.
Oh.
And so it was a really nice outdoor
Where was
event. Over there by West LA area.
Oh, nice.
Yeah, so we would just got to spend time. You meet other people.
Nice.
It was a nice little outdoor event. They had vendors there, food
Nice.
vendors. They had vegan tacos.
Good.
Yeah, so that was my.
I should have been there for DLA. They didn't have anything like that.
No, it was mostly just food vendors. Yeah. Which is
something. All right. We can. It doesn't show, but we can start.
Okay, sure. So, good morning, everyone. As some of you may know, or some of you may not know, I'm Natalie, and I'm here with Dr. Miriam Bakhtiari. She is the inventor of BLA Fit. It's an amazing facial exercise device that you only need to use for 1 minute a day consistently in order to achieve beautiful results like plump lips, a defined jawline, and lifting your cheekbones, as well as helping you to tap into your parasympathetic nervous system to relax your muscles. But before we get into BLA fully, I want to introduce Dr. Miriam because I want you guys to know a little bit more about who she is. She is a board certified dentist with over 29 years of experience in TMJ, sleep apnea, and orthodontics. So this woman really knows your facial muscles very well. She's very smart. She knows what she's talking about. I've learned tremendously from her. So many things you would not even have any idea about, like how your diet can affect your facial structure, which I never would have even thought about that. But let's get into BLA now that we know some more about Dr. Miriam. What we really want to know is why you invented BLA, why you thought there was something missing in our culture about education, about our facial muscles, about why there is a lack of understanding of why there's asymmetry, why people have TMJ.
And I know that Natalie, we had the topic for today as physical therapy.
Yes.
For your TMJ and facial muscle.
Mm-hmm.
We're going to touch on that too.
Absolutely.
First of all, I wanted to say hi, everybody. Good morning and a beautiful Monday. Another day that we're alive. I'm thankful to be alive, and alive in a country that we actually have some freedom.
Right.
There's other places that you don't have what we have here, and we're healthy. And I want to first tell you that you look beautiful.
Thank you.
And I'm looking at your skin. Your skin looks radiant.
Thank you. Sunblock.
Sunblock.
Wear your sunblock, people.
Yeah, and also whatever you're doing, your skin tone.
Benzoyl peroxide.
Yeah, good. Because whatever you're doing, your skin, when I'm watching it, and we're very close together at work and everything, and I'm looking, wow, she looks radiant.
Thank you.
Simple and beautiful.
Oh, that's so sweet.
So, going back to, thank you so much for introducing me the way you did. I didn't have to tell you much about me now, but just to tell you that it's true. I really have invested my 2/3 of my life to the field of jaw, TMJ, facial muscles, symmetry, beautiful smiles, people with sleep disorders. So I do know your facial muscles pretty well. And you asked me, why did you invented Bella Lip Appliance? Really quickly, because I want to really spend time on the physical therapy aspect of Bella Lip Appliance. Well, when you create beautiful smile, you will see that a lot of the models out there, changing the subject, a lot of the models out there, you look at them and you see them usually from sideways, because a lot of us are missing facial symmetry.
Mm-hmm.
And that's because we're either one-sided chewers or clenchers, and we work out one side of the muscles more than the other. Some of us also have jaw issues, and we have jaw, one side of our, let's say the right side of our jaw, the whole lower jaw is different than the right side. When we take your x-ray, one side looks longer than the other, so the muscle pull and muscle work is very different. I knew that creating beautiful smile, I can kind of symmetrize the bony structure. Now, what are we going to do in the muscle? How am I going to create something that when you work out, you'll get both sides of your face worked out? I know there's a name to that. When you work both sides of your body.
I know the word too.
Isometric.
Yes, there you go.
Isometrically working both sides of your facial muscles so that you have symmetry. We can't change the fact that at night we clench, we grind. We can't change the fact that somebody feels more comfortable chewing from the right than the left, but we can work out that left side as well so that they look more balanced. When we're all day long eating, clenching, talking, and we favor one side of our body more, just like I'm right-handed, my right side's stronger than the left. If we do isometric workouts, we're going to give more strength to this side so it's not completely off. Facial muscles are the same. We have very little muscles, 50 plus little muscles. Just imagine from around your lip to underneath your eyes to your neck, they're all connected and they're top overlapping each other. And when we do a specific workout and exercise with specific resistance around the lip, we're able to anchor and engage these facial muscles. And because it's isometric exercises, we'll be able to balance both sides. So people that use it, if you look at our before and after pictures, you'll see a lot more symmetrical faces. You see longer neck because you're elongating and releasing the neck tension. And for people that clench at night, the muscle that is your clenching muscle called masseter. If you look up masseter muscle on your internet, you'll see a muscle that attaches to the corner of the jaw. So it comes from your underneath your cheekbones and it attaches to the corner of your jaw. And when we clench, that muscle keeps bulking. And when it bulks up, it becomes shorter in length. And when they become shorter in length, they limit your jaw movement and range of motion. So now we have a face that clenches and has a big fat masseter on one side, a less bulkier on the other side, so it's asymmetrical, but at the same time the range of motion is limited. We get jaw tension, we get ear issues, and so forth, TMJ problems. With the bellow lip appliance, one of the exercises that's intended to get your lip muscles engaged and plump up your lip, it also works out your jawline, the vertical exercise. And by using the vertical exercise and shifting your lower jaw forward, and if you guys are here, follow us on TikTok under DLA Fit. You see tons of videos that have this movement, and it's basically the vertical exercise. When you move your lower jaw forward, you're actually stretching the masseter that's been clenching. So what you're doing is basically you're stretching your hamstring that's been lifting. So you get a little bit elongated masseter, and by elongating your masseter, you're actually creating symmetry. You're getting rid of that bulky face that looks like you've clenched, and it's kind of like a hamster. You know, the hamsters are clenchers. They have like this big thing. We don't want to look like that. That's not very aesthetic. And a lot of things that are out there, unfortunately, they really work out the masseter. And when you work out the masseter, you have this big, giant face that's very square, and to me, much more taller, elongated, symmetrical face is much more pretty. Does that make sense? So that's how we do the physical therapy. A lot of our patients that have TMJ, they have their muscles are really hurting in the morning. When you do this exercise, it's kind of like somebody stretching you, but you're doing it on your own at the comfort of your home for 1 minute a day. And we train you how to use it. We will walk you step by step through learning to be a master user of BLA. So this is the exercise that's basically, we use it as physical therapy for patients with TMJ, clenchers, waking up with headaches. This is one that you would is the only thing that's anchoring around the arms. And this area is called resistant arm. The resistant arm is your weight that bears the arms. So when you do the arm movement, you have a weight that you're pushing. So it's got the resistant bands, right? So
always make sure you're holding on to the resistance band to avoid it from shifting around. When you do the vertical exercise, you want to make sure it's completely vertical and doesn't start moving more towards the left or towards the right. As well as use your upper and lower lip, and at the same time shift your jaw forward. And then to maximize this exercise, you can incorporate breath work into it by taking in a deep breath in from your nose when you're in the closed position. And as she's opening, she'll begin to exhale either from the nose or from the mouth, whichever feels more comfortable for you. But the most important thing is inhale through the nose. Notice how all these exercises that she performed were very slow and controlled.
So I feel like my lip muscle have been done the work, but I also feel my cheek muscles and my masseter, my clenching muscles are really stretched and relaxed, and it doesn't feel tight anymore. And what I also feel is that the breath work through my nose, breathing out through my mouth, increase the pure oxygenation to the brain, creating better immune system, creating a relaxed mind, tapping to parasympathetic nervous system, and just changing the direction of your day. Imagine doing 5 workouts that last 30 seconds and changing the way you think today, the way you feel today, the way you perform today, by not only feeling more beautiful, but also feeling internally really great, calmer. How you feel is like basically everything is more shiny, the colors are more beautiful. I'm just in a different state of mind. Mm-hmm. And 2 of the reasons that you tap in the parasympathetic nervous system is 1, the jaw forwarding opens up the blood supply to the brain. And I'm going to do this because this is so important for me, for you to be educated. When you move the jaw forward, you're opening the blood supply to the brain and calming the brain, because with clenchers, this is push back. The masseters that are tight push back and cut the circulation to the brain, and brain is always in fight and flight, nervous, noise sensitivity, agitation. It's part of the clenching muscle. By moving the jaw forward and stretching the masseters, we're actually not only stretching the masseter, but also opening the circulation to the brain. By nasal breathing through the system, we're actually cleaning the nasal oxygen that goes through our nose in our nasal, paranasal sinuses. We purify that oxygen to nitrous oxide. Now we're zapping any bacteria, fungal, or virus that comes in our body. It zaps it. So we're increasing the immune system by nasal breathing, by opening the circulation. At the same time, we're actually making ourselves more beautiful. So it's inner and outer beauty in just 1 minute a day.
Just 1 minute a day. And this is why we also emphasize the importance of the 5-minute one-on-one Zoom trainings that we offer with the purchase of your BLA, because we want to make sure that you take advantage of our time, and you also learn how to efficiently use the BLA appliance. It's very easy to get confused on doing it very fast, doing it kind of sloppy. You're not actually doing the exercises slowly and controlled, or you don't know how. Some people apply the anchors, the handles onto their teeth, or there's just a lot of common mistakes, and we want to make sure that you don't do that. We want to make sure that you actually get the best results that you can possibly get, and you can take advantage of that by getting the 5-minute consultation that we have.
And I think, Natalie, what's important is through our growth of our company, slowly we learned that our main objection and our main goal or ideology about being here today on our day off is for awareness and for education, for the fact that if you bought the product that we have, which I stand behind it, and it's durable and it's not something you need to change every day, it's at least lasts you a couple of years, I want you to be able to use it. I don't want this to be another makeup gimmick in your drawer. And I want to make you understand the wholesomeness of this product, the non-invasiveness of this product, the fact that there is a lot of thought behind it, and there's me behind it to teach you, and to understand that everything that goes in your mouth that just claims that it will bring bigger lips, not necessarily are non-invasive, not necessarily it's good for you. A lot of us are looking for that fast gratification, but I want you to know that when you do self-care from inside out, it's a much different beauty. It's a much different result, and we want to make sure that you're trained and you know what you're doing out there.
Exactly. And also I want to point out something that is really a common misconception about how we're oftentimes compared to like the gua sha. While the gua sha is great and we're not saying it's not a good product, the main difference between us and products like them is that we're targeting the internal aspect. We're targeting the actual muscles. The gua sha focuses on the exterior portion by doing lymphatic drainage. So most of it is just like the outer portion. You're not actually changing any of the actual muscle or the structure. So that is the main difference. You can, we've had questions before if you can pair the two together, the gua sha and the belly appliance. Of course, you absolutely can, but it's not.
They're not the same.
They're not like you can just interchange them one or the other. Both of them have different goals and different results, and so we just want to.
Gua sha is like you're massaging. You can compare gua sha to a massage, and you can compare the belly lip appliance to a workout. So if you go to your gym and you're doing weightlifting and you're doing resistant training, it's a very different workout than when somebody goes and lays down and they get massaged. And they increase circulation from outer, like what you said, lymphatic drainage or outer skin. What belly lip appliance does, through your lip, we're engaging every muscle that attaches together, all from under your eyes all the way to your neck, and we're bulking those muscles in a direction of not clenching, is a direction of balance and symmetry and beautiful, so that your cheekbones are going to be lifted, that your lips going to feel fuller from internal out, not just the outer skin with injections and increasing the mass of your outer skin. One of my patients was telling me that we had a patient here, and I think we videotaped her, and we have her in our Dr. Miriam Instagram, and we covered her eyes, and it's just her voice. She came here because her lip, she had lip injections for years, and now she's in her 60s and she doesn't want to do lip injections, but she came to me because she thought that it's caused by her bite, that her lip is constantly being bitten, internal part of the lip, and it became like a little fold that came out that may have to be cut at some point by a surgeon. And I didn't realize, I knew she always gets injections, but I didn't realize that moment, and it took me a moment to look at her as a scientist that always wants to find out. I'm the clouzou of the problems that comes from dental aspects. So I was thinking, why is she all of a sudden biting her lips? And it just dawned on me that she's not getting lip injections. And when we inject the outer layer of the lips, it looks beautiful in some cases, not all the cases. But then what we're doing is we're increasing the surface. We're stretching the skin. And if you don't get injection, you have extra skin that's going to be hanging around. So you have to keep it up for the rest of your life. So if you're 16, imagine every time you get injection until you're 50, 55, 60, how much trauma, how much money. And now by age of 50, you're not going to look like you anymore. Every time we get injection, we're looking different, the lips, and we see people with lips that are asymmetrical, lips that are really look sick. And we've seen infections with lips, too many things happening. And I don't mind if you're in your 50s and you want to get lip injections and you're going somewhere for once or twice, but I don't encourage a 16-year-old, 17-year-old to make this a lifetime habit of injections. It's too invasive, too expensive.
It's very expensive.
But I want the new generation to
Yeah.
learn there is something that you can do from young life to prevent sagging, to elongate your aging process. And that's why we're on the TikTok and we're trying to get the young generation with different ideas attracted to see what is that they're doing, and to learn that self-care is very important in a non-invasive, holistic way.
Absolutely. And I'm glad that you bring that awareness to it, especially now that I want to point out how people always want to get like the lip injections as well, that they're going to people that aren't even certified, and that can be very dangerous because they may not know exactly what they're doing just because you want to achieve a certain look. And so to go to that extent of like putting your health on the line just to like obtain this certain aesthetic, it's very scary seeing that. So we want to make sure that we're safe about things. And this is a really safe appliance. You're not going to hurt yourself. And you want to make sure that you're just safe about all the decisions you make in general. So
that's right. And then maybe we can have next time on do's and don'ts.
Yes, absolutely. There's a lot of do's and don'ts, and we want to make sure that you guys all understand it. So thank you so much, everyone, for joining us. Thank you, Dr. Mariam, for joining us. Enjoy your week. We'll see you guys here next week.
By the way, send your questions to us via Amazon, or you can go to our website blafit.com and send any questions you have regarding the appliance. Make sure that you understand it, and we're here for you.
Or Instagram, which is blafit. We respond pretty quickly there as well. So if you have any questions, just let us know.
Take care.
Thank you.
Okay, you're gonna put this on YouTube. Are you putting them on YouTube?